All right, I'm recording now.
Hi, John. How are you?
Hi, good morning. Here to talk about monkeypox.
Yeah, I was thinking we finally reached the point of seeing COVID-19 in our collective rearview mirror, and then monkeypox shows up.
Right. Can't win.
Yeah. When I first heard about it, though, I thought, we got this. We just been through COVID, and this is definitely not as bad as COVID.
Right.
What did you think about when you first saw that, this is reaching?
My first thought was it's fear-mongering. Like, okay, the media needs something new to, scare people with. But then...
Wow.
Which sounds...
You went there.
Yeah, I went all out. And then part of me was like, okay, step back. The CDC is used to not scaring people at this point, or trying to not scare people. So let's see what this actually is and see what the details are.
Yeah, nothing is ever that simple. What we know now is that monkeypox cases are doubling every 8 days since May. President Biden has declared it a public health emergency. And as of August 10th, there were 10,392 cases in the United States.
Yeah, so that's growing very fast.
Yeah.
I feel like.
So our guest today is Dr. Jennifer Grant, an infectious disease physician with NorthShore University Health System. We are going to ask the pressing questions about the monkeypox virus, preventing the spread, staying safe, treatment, and vaccines. For example, can I get monkeypox from touching an escalator handrail? Trying on clothes in a fitting room? Is it airborne? Is someone contagious before a rash appears?
Looking forward to it. Let's talk about it now.
Welcome
to
the
Healthy You Podcast.
Can we start over?
Yeah, all right.
All right, here we go. Welcome to the Healthy You Podcast from NorthShore University Health System, where we explore trending topics in healthcare. I'm Carolyn Starks.
And I'm Jon Hillenbrand.
Hey, welcome once again, Dr. Grant, to the podcast.
Thank you so much for having me. I'm excited to be here again.
Which I can't believe we're talking about a different virus. And I was wondering, too, in your infectious disease circles, when you heard of monkeypox virus now coming, from West and Central Africa to the United States in a different context, what was it like? Are you kidding me? I can't believe this is happening.
Oh, 100%. I feel like maybe the stages of grief is a good way to describe it. Just completely first, no way, this is not happening. The universe would not do that to us.
Right. Yeah.
Are we being punked? What's happening? And then realizing, okay, no, this is happening. And then you kind of move through and just dive right in. I guess that's what we do.
So let's first review the basics. Okay, so what is monkeypox?
So monkeypox is a viral infection. It's part of a larger family called the orthopox virus family. And so it's actually related to smallpox and cowpox, which is the virus that gave us the vaccine for smallpox and really started the vaccine movement. Everyone's probably heard of smallpox and thinks of it as this horrible, deadly disease. And it's true. Monkeypox is much, much less severe than smallpox. Related, both cause a rash. And I think we'll talk about that more, some of the clinical features.
Yeah, let's get into that. What are the symptoms?
So rash. 100% of patients essentially with monkeypox get a rash.
When you say rash, do you mean the lesions and the pustules they're talking about?
Yeah, exactly. So it kind of evolves. In some people, it starts kind of like these flat circles, and then over time evolves to be these kind of raised bumps, like nodules. They look like they might have fluid or pus inside. The classic description, they have a little kind of punctate hole in the center. They call it umbilicated, like there's a little divot in the center of the lesion. And they can be all over.
Where are these things?
Yeah, they can be anywhere on your body. In the current outbreak that we are seeing, which is different than in the past, a lot are presenting in the genital region, but they can be on your arms, legs, your torso, your face. It's interesting. One of the viruses that can cause a rash on the hands, the palms of your hands, and the soles of your feet too.
Oh, interesting.
That is interesting.
Now, is that because that's where the virus entered your body, or is it just random? That's just where it's coming out?
A little bit of both. It is, in some places this is where the virus is being contacted and entering, but people also can have lesions in other parts of their body that's kind of spread once it's in.
Gotcha.
Can you have any internal lesions?
You can. Some people get sores in their mouth or their mucous membranes, and There are other symptoms besides just the rash. Some people will have fevers, chills, swollen glands, headache, or just feeling sick.
Okay. And are the lesions, is that the correct word to use, lesions, by the way?
Yeah, sure.
Okay.
I think that is a word we would use all the time in medicine.
Okay. Are they painful?
They can be, yeah, or they can itch.
Oh, okay. All right. Then now how does it spread?
So
This current outbreak.
Yeah, the virus is spread by close contact. And by that, I mean there's direct contact with the lesions themselves or material from the lesions, like skin to skin contact, or close contact with respiratory, or I should say oral secretions. We are seeing in this epidemic a lot of sexual transmission. It's not only sexually transmitted, though. It's other close contact, hugging, kissing, even household contact, like very close household contact with other members, with someone infected in the household can spread it that way. It can be spread on surfaces. Bedclothes or bed sheets are kind of commonly implicated as a way that this might be spread within kind of households also.
So that was also one of my questions. An infected person, say one of their lesions has contact, or the fluid in it has contact with a pillowcase or a bed sheet. Now, how long is that material considered contagious?
Or do we know?
Or do you know?
Yeah, I know. I have a couple numbers that I've read. So it's true that the virus can live on surfaces, and they probably think the porous surfaces of like sheets and clothes more so. But the virus is also easily killed. So it survives in kind of like dark, low humidity, low temperature areas much better, but it's easily killed by UV light. And it's easily killed by disinfectants. So how long it stays around and is contagious is really not clear. I mean, they found it. I think one of the numbers in the CDC was 15 days later, okay? A person leaves this house and they still find some evidence of the virus. But is that dose infectious to another person? And what would have happened with kind of like normal cleaning and disinfecting stages is unknown.
Right. Like if you slept in that bed, would you get it? Or is it just like trace amounts at that point?
Right. 15 days later, I don't know. Now, since it is spread on surfaces, we do know that sharing a bed with an infected individual is not a good idea. But yes, how long does that stay on day-to-day items is really not known, but it's not thought to be spread from contact with day-to-day items.
And does washing bed sheets like get rid of it, or is it in the threads?
That's one of the kind of questions that we've gotten is, what about the laundromat? Is that a safe place to go? Other people are washing their sheets there. Should I wash my sheets there?
That's a good question, actually.
But yeah, that's thought to be safe. I mean, the washing cycle will, that will kill this virus. So that is not a concern.
But maybe don't help someone load up the washing machine.
I mean, maybe, I guess that's, I don't know who does that,
That's true. That doesn't happen.
With how hot those temperatures are, even in your own, dishwasher, if I see something and it's not completely clean, I'm like, I know it's still probably safe.
Right. That's true.
After the temperatures.
So you're bad at dishwashing.
Yes. Okay. So the other question I have, is it safe to try on clothes at a clothing store? Or say, for example, touch a handrail on an escalator?
There are unknowns about this, but that is not something that I'm concerned about at this point.
Clothing,
I think
trying on the clothing, right?
Clothing and the surfaces, things like that. I mean, the one kind of
Can I say one thing though? As an infectious disease physician, I mean, aren't you always looking at handrails like,
Yeah, that's a good question. I think that in infectious disease, there's some who have become germaphobes because what is out there and everything is there. And I tend to fall on the other side where I know that the whole world is covered with bacteria and germs, and you wash your hands, you do your best, but a lot of it's just, this is life. This is what we deal with every day, day in and day out. So I do carry hand sanitizer, but I don't have one of those little elevator push button things.
Oh.
So somewhere in that, in the middle.
I kind of just now in the world of COVID and now I kind of make a mental note that I'm touching doors and are using escalators, and I'm going to go wash my hands.
That's how I am with cats.
Don't touch your face,
Yeah. When I pet a cat or a dog, then I'm like, okay, don't touch my eyes because I'm allergic.
Yes. No, I agree. There is definitely, I think I'm more attuned to hand hygiene than I was even as an infectious disease doctor since COVID has started.
Yeah, definitely.
So those are always good precautions.
Now, let's talk about if somebody coughs and there's respiratory droplets in the air. Are those droplets airborne? Or does that have to enter your own, respiratory system? Or how does that transmission happen?
Good question. So the respiratory route of transmission is thought to be much, much more minimal than the direct contact. Mm-hmm. So it's not like COVID. If I had monkeypox, you would not be getting monkeypox. You won't get it walking down the street. You're not going to get it just talking to somebody.
Okay.
It's not going to linger in the air in that same fashion. Now, the CDC does recognize, respiratory droplets as a potential source, probably more so very close contact, like kissing, face-to-face contact, things where you're really close to another individual. But they do recommend that if you are infected, that you wear a mask just in case. And I think this is one of those active roles or active places of investigation. The CDC is really looking into how much of it is spread potentially through droplets.
Right.
So the whole picture on how it's spread is still being looked at because now we have it in this new context, right? Out of here. So here's what I read, and I wanted to run this by you. More than 99% of the people infected so far are men who acquired the virus through intimate contact with other men, according to the CDC. Researchers have found the virus in saliva, urine, feces, and semen. So I'm wondering if we know yet if these fluids or solids are contagious to other people.
Yeah, I think, respiratory and saliva, to my understanding, is contagious. Whether it's spread through like something like semen or vaginal secretions, that is not yet known. Whether it's that route or just the skin-to-skin contact route, the
or
lesions.
If you have lesions. Okay, gotcha.
Yes.
Okay.
So there's definitely a lot of investigation, happening in how exactly this is spreading. I think when we talk about COVID, it was kind of like the opposite. We're like, oh, don't worry, about the surfaces. Don't we kind of like threw that out the window, and it's all, respiratory. Now, this is definitely much different. The respiratory pathway of spread is nowhere near where it would be with something like COVID.
Like COVID.
Yes.
Then why is it doubling like what did I say in the beginning? Every 10 days?
Yeah. I think we just don't have a total handle on controlling the spread of it at this point. It's still, to put it in context, we have over 10,000 cases, I believe, in the United States, but we have 100,000 cases a day of COVID. So it is, even though it is a pretty substantial, outbreak that we need to get a handle on, it's like nowhere near the scale that COVID is. But it's spreading. We also have increased availability of testing and access for testing points, so more people know about it. More people are out there getting tested. But I do agree. I think we do not have a handle yet on controlling the spread of this.
So how concerned are you that it's going to spread to the wider community?
So there's nothing about this virus that says it can only infect men or only infect people of a certain, sexual orientation. It can spread. Other people can get infected, women, even rare cases of children. So I think while it's spreading in one community, we all have to keep an eye on it because it can definitely spread outside of that community. Now,
do you see that happening like at a larger scale, or is it just a big unknown at this point?
It's a little bit unknown. I mean, I think it will spread outside. How big that will be, I'm not certain. Again, it's going to be nowhere near something like COVID in terms of the scale.
Right.
But I think there definitely will be kind of spread outside just based on the way it's going.
What's been like the healthcare response at hospitals? Like if someone is suspected of having monkeypox, do they have people in there with like the full suits and the pampers and everything? Or
Yeah, that I'm sure that is like very intimidating for patients. It's essentially the same personal protective equipment or PPE that we use for COVID. This is based on some of the CDC guidance, and I think things will probably evolve as we learn more about it.
Right.
But right now, kind of, it's erring on the side of caution. So people do wear gowns and, the N95 masks and obviously gloves when they are examining someone who might have monkeypox.
Which brings up another question. And this is like rapid fire.
Yeah.
Bring it on. I'm ready.
We're
I
throwing
know,
them all
you
at
are.
Yeah.
Like,
Doing great.
can't stop
Keep it
her.
up. Yeah.
You were talking about, Jon, coming into the hospital. So at what stage should someone see a doctor to get a test, and what is that test?
Yeah, I think if you are worried that you have monkeypox based on lesions on your skin, you should go and get a test. Now, right now, the test is essentially the only thing we can test is the skin lesions. It's a swab. Kind of looks like a COVID swab. And the doctor or healthcare provider will take it and kind of rub it over the lesions. And then they'll put it in a sterile container and send it off to the lab. But I think it's important to, if you're worried about it, especially if you are in a group at high risk, if you're a man having sex with other men and you know somebody or somebody in your social network has it, this is the population that we really want to be on high alert. Come in, get testing. If your doctor's like, oh, no, I don't think that's monkeypox, just make sure to advocate for yourself and get this test done because it's really important.
And if you do have it, if you are positive for this, is the treatment like you're going to be hospitalized or is it like at-home treatment or what?
Yeah, good question. Primarily at-home treatment.
Oh, interesting.
So this tends to be self-limited. It goes away on its own. It takes a long time to go away, which is frustrating. I mean, it can take a couple weeks for these lesions to resolve and completely fall off.
Is that when you're not contagious?
Yeah, that's kind of a kicker here is that again, I think this is evolving and changing, but right now the guidance is that you could potentially be contagious until all your lesions have kind of scabbed over, fallen off, and you got fresh skin underneth.
Wow, that's a long time.
Yeah,
right?
Yeah.
Like, what, 2 weeks, I think?
It could be up to 4 weeks. It can be a long time. So it's at-home treatment, kind of isolating and waiting, supportive treatment for symptoms that might be bothering you. There is an antiviral treatment that is available through the CDC and other health departments, but it's really reserved for people who have severe illness, who are really sick, who are in the hospital, who maybe have sores in their mouth and can't eat or swallow very well, or for high-risk situations, for instance, like maybe if there was a pregnant patient or a child or someone who was really immunocompromised and sick and got the virus.
So what are some other at-home care? Like, should you cover the lesions?
Yeah, anytime you're in contact with somebody else, you should keep your lesions covered and wear a mask.
Stay home from work.
Yeah.
Which everyone is doing anyways, pretty much.
Right, yeah, work from home, recover from home.
Right,
Yeah.
Yes.
And what kind of things would you cover up a lesion with? Like a Band-Aid or like a big bandage or like with your shirt or,
Yeah, I think, right, loose-fitting bandages. I mean, the shirt is probably fine. You obviously want to make sure that you're like washing your shirt, and kind of cleaning your clothes as much as possible. I think some of it does depend on whether you're isolating by yourself or you're isolating with other people in the house. The CDC actually has a lot of information on this, of things you can do if you have monkeypox and are isolating. At home, you live with other people, kind of ways to keep the lesions covered, to avoid, contact with certain items, to disinfect things. So there's a lot of guidance out there.
Great. We'll put that link in the description of this episode.
Perfect.
Let's talk about what vaccines are available out there.
Yes. So I mentioned at the beginning, this is a virus that's related to smallpox. And we have smallpox vaccines. We have
that our children get as babies.
Yeah.
That one.
Right. Or that they used to get. So we don't get them anymore. But
we don't? Wait, what?
Yeah, I think it stopped in like 76 or 79. I'd have to look. But yeah, we don't. Because of the eradication of smallpox, vaccination stopped. That is actually one of the thoughts as to why we're seeing this now, is because people's immunity to smallpox has waned, and that vaccine was providing some protection against monkeypox as well. So the smallpox vaccines exist. There is an older one called the ACAM 2000 vaccine that is actually a live replicating vaccine that we don't really use that vaccine much because there are potential side effects. There is another one, a newer one called Jynneos. And that is the one that you're probably hearing about or seeing about people getting the vaccine. So newer vaccine, the virus does not replicate. So they're really, the side effects of the older vaccine are not there with this one. But the issue with this one is that the supply is still limited. So it's not out there where everybody can get a vaccine. We're really focused on getting it into high-risk groups. So someone who's had contact with someone who has monkeypox or someone who's in a social network where it's circulating. And even in those situations, there's takes some time to get an appointment, and there's some walk-in clinics, but I hear they fill up really, really fast. So the supply is still limited.
And are we offering that here at NorthShore?
Oh, we would love to. We are waiting to get it. We're working with the health department to have this vaccine available to patients, as well as to potentially any healthcare workers who might have had a patient exposure that requires a vaccine. Most do not, but occasionally it happens. And we're kind of in discussion with the healthcare departments to get that here and how to make it work. Right now, it's mostly community health departments. We can put a link in too. There's a lot of places in the city that have resources for getting the vaccine.
Oh, well, that's good.
Great. Do we know anything? This is the scary thing. Do we know anything about asymptomatic spread, like when people don't have any scabs or lesions?
Yeah. So classically, it is not thought to spread without symptoms. But at one point being that the first symptoms you might get could be the fever, the chills, the swollen lymph nodes. So at that point, you might be contagious from respiratory secretions or saliva, something like that. But without having any symptoms, no, it is not thought to be contagious. This is another thing that the CDC is actively investigating. As this kind of epidemic has evolved from what we used to think of monkeypox, 5-10 years ago to what we are seeing now, there are questions about this, and it's being looked at, but right now it does not seem to be the case.
Do we know, I know with some viruses, there's long-term effects like sterility or like mental impact. Is there anything like that with monkeypox?
Yeah, like long COVID, long monkeypox.
Yeah,
Right.
good question.
Yeah, that is a good question. I haven't heard. I don't think there is.
Too
It's
soon.
not something kind of that's on the radar. There might be some, slight scarring from the lesions, things like that. But in terms of, other sequela, not aware of any.
Okay.
What are some of your main messages to the community? We want to get this information out, obviously. And can you pick out which ones are most important for everybody?
Yeah, I think first of all, just understanding what's going on, knowing that this is there. You still need to be more worried about contracting COVID or many of the other respiratory viruses that are circulating than, monkeypox in everybody's day-to-day lives. But there is a community that's being hit pretty hard, and we really need to focus our resources and kind of prevention efforts there. And also try not to stigmatize it. I think that's a big issue too. We want people to seek treatment. We want people to seek testing. We want people to feel comfortable talking about their concerns about it, and not feel like they have to avoid a doctor because they're going to, look down upon them for having monkeypox. So I think that's really important. And I think it's, there's kind of like an adage that you hear sometimes, like nobody's safe until everybody's safe. We don't also want to say, oh, well, it's just affecting this person over here. It's not going to affect me. I'm going to ignore it. I think we still need to put a lot of resources into this and try to stop the transmission that's happening now, because there is the ability for it to affect people outside of this community.
Right.
Yeah, I was wondering actually about college, universities, and campuses.
Yeah. I think that is a possibility that there could be small outbreaks. Again, I don't think it would be anything near the level of COVID that we kind of saw and heard about.
Yeah, we're sending
when
kids home.
went back to camp. Yeah, and quarantine dorms and things like that.
Yeah.
But I do think it's really important that these universities are prepared with education. Here's how it's spread. Here's how you get tested. Make sure that there's tests available at student health. Make sure that there's plans in place. So I think it's really important to be prepared.
And why it's really important to get all this information out. And, I'm so glad that we can just feel so comfortable asking you pretty much anything.
Right. But where did the name come from? It's a pretty terrible name.
It is a terrible name.
It is, right?
That is a good question. So it was first noticed in monkeys. I think these monkeys were in captivity, and they came down with this virus that they saw was spreading, causing pox, these lesions, kind of, we have smallpox and chickenpox and these kind of,
Right.
nodular crusted, ulcerated or pustules, got the name pox, and because it was found in monkeys. But monkeys don't really have much to do with it. They don't harbor the virus. It's probably the reservoir, or where it kind of lives and doesn't cause disease, is some type of rodent, we think. We don't know exactly. So the WHO, to your point, is actually going to rename it. They've announced that they have scientists looking at how they're going to rename the virus itself and the different clades or the different families of the virus. We don't know what that name is yet, but
Soon?
that will be...
You mean like soon?
I think so. I think they said a couple weeks. I can't remember exactly, but yes, they're looking at they agree with you. It's a bad name, and they think that we should rename it.
That's actually, I think that'll be really, really helpful for not stigmatizing people because it does have a terrible name.
Yeah.
Yes. And I, now that you mention it, I was trying to look into why chickenpox is called chickenpox. I couldn't find it. I did a very brief search, I will say, but viruses have weird names sometimes. I don't know.
Do you remember how quickly though we went from coronavirus to COVID-19?
Yes,
I mean,
do.
That went quickly, and people caught on, and it just became part of our lexicon.
I remember thinking when they first renamed it, I was like, oh, it's going to take forever. People are never going to get it. And then you're right, like
It's
immediately.
very common,
Yeah, immediately. I think, the media was very good on being clear, and those science writers were very clear on this is this. Like even with monkeypox, it's the virus versus the disease again, right?
Yeah, a lot of the same terminology.
Do we know the spread in the United States of like where it's concentrated, or is it everywhere, or is it at port cities?
Yeah, it is. I don't remember the latest map, but I think it was in like 47 or 48 states. It's pretty much throughout. It is concentrated in like metropolitan areas more so. I think Illinois, almost all the cases are in Chicago versus like, other like Southern Illinois. And I think we are somewhere around the 5th highest number of cases. California, Florida, Texas, New York all have a lot of cases as well. And mostly, though, in metropolitan areas.
Big cities.
And no deaths.
Not in the United States. That is a good point. There have been a couple reported globally. Not a lot of details. One person was reportedly very sick with lymphoma. So no deaths in the United States, no deaths in Chicago. But yeah, there is a chance of severe illness and death, but it's very, very small.
And this isn't something that can morph like COVID was, right?
Or does that depend on how many people get it?
Yeah. It is definitely not going to be as evolving as COVID was. Now, all viruses evolve. They all mutate. What is the significance of those mutations? It's not thought to be anywhere near, what we saw with COVID. But are there probably mutations happening along the way? Yes. We just don't really know, what's the significance of that.
Right. Okay.
To be determined.
Yeah, I mean, thank you for being here once again. I mean, it's so great to get this information out, and sorry for the rapid fire questions, but you held up once again.
Problem.
Yeah, impressive.
Yeah, thanks for having me. I'm glad to talk about it. I feel like even though, yes, we are, we're like, oh gosh, no more, cut off the viruses. We can't take another one. I think it's really good to try to get this information out there and make people aware and just share the knowledge and help people understand so they can take precautions, but, not be too scared either.
Yeah, it is that balancing act.
Thanks, Dr. Grant.
Yeah, thank you.
Appreciate you being here.
Awesome. Thanks.
If you would like to get more information about monkeypox, you can go to northshore.org/monkeypox. We'll have a link to that in the description for this episode.
If you have any topics that you'd like us to discuss, email us at publicrelations@northshore.org, and we'll be happy to get to those topics for you.
You can also follow us on social media at NorthShore Web on Instagram, Twitter, or Facebook.
Thanks for joining us.
See you next time.